I'm Dr. Francisco Ceseña. I'm Chief of Staff of the Oasis of Hope Hospital. I'm here to speak to you a few words about brain cancer by answering some of the most frequently asked questions in this condition. What are some of the early signs of brain cancer to watch out for? Brain cancer is not a silent condition. Brain cancer becomes manifest very early in the course of disease. So most of the time, patients will refer headaches, and these are particularly intense headaches. These are particularly progressive headaches. So you'll be seeing your doctor pretty soon if you have a headache of that nature, especially if you've never had one. You could have a seizure as a first presentation, which is obviously extremely disquieting, and you will see a doctor very soon after that. You might also have signs of nervous function impediment, such as a weak arm or a weak eyelid. So any symptom that indicates some form of dysfunction in your nervous system will lead you quickly to the emergency room or your doctor. Question number 2. What are the risk factors for brain cancer? Interestingly, brain cancer does not have a set of risk factors or prevention factors. There are no measures for prevention, such as with other cancers in which diet and work activities have a lot to do with the genesis of this cancer. However, it is likely related to the modern lifestyle, which are common to the other cancers, such as excessive meat protein. The maintenance of good dietary habits is probably the best way to address this as a prevention measure. Question number 3. What characteristics make each tumor different from each other? Well, brain tumors are a very wide spectrum of disease, very wide. There are some that act very much like a benign condition and cause very little neurological issues. And then there are cancers which are extremely aggressive, biologically very aggressive. So, the likelihood of getting higher grade disease are the most common cancers, unfortunately. And so the specific type of cancer will determine the specific type of management. What are the treatment options and how does a physician determine the best route? Brain cancer therapy has not changed very much over the years. Surgery, radiation continue to be the mainstays of therapy because removing the cancer and then removing the possibility of cancer recurrence are the primary measures to be done in this type of cancer. So there's not a very wide selection or a very wide list of therapeutic options in this particular setting. What are the long-term cognitive and neurological impacts of brain cancer treatment, and how can patients prepare to or recover? Modern surgical techniques, modern radiation therapy techniques means that the patient has a very good chance of living a normal life beyond the point of treatment. Early detection, or that is treating small cancers, means that the patient is going to have a very good functional recuperation. So, there's a lot of advances in detection and treatment for the disease in regards much earlier approach, and therefore patients will have pretty much, generally speaking, pretty much a normal recovery. The consequence of having the disease will depend on exactly where the tumor was located, what part of your brain was affected by the tumor. If this area has to be removed in a complete fashion, then you might have a significant deficit, but your brain is very resilient and can recover very quickly by forming other connections, so to speak. How does brain cancer affect emotional health and personality? Like any other serious medical condition, losing your health is like losing a loved one. So when you lose your health, you really go through a grieving process. The sooner the issue is addressed, the sooner you feel recovered, the more likely you will not have lasting or significant impact to your emotional health. If the disease results in some form of restriction, a functional restriction, that can be very hard to handle. So emotional support, psychological support will be very important. The way to recover is to focus on what you have and not what you lost. Using that approach, most people or most of these persons are able to gain complete emotional, psychological health. It works a little bit that way in the disease and cancer. You know, once you've resolved the issue and you understand that you may have dodged a bullet and that you have a good chances for maintaining your health, that usually helps to abate your psychological, emotional problems that may have been incurred. Can it be cured? Well, the answer to that question is basically as varied as the types of cancers that affect the patient. As I mentioned to you before, brain cancers are cataloged or classified from grade 1 to grade 4. Grade 1 are the most benign cancers, quote unquote nice cancers. Grade 4 are absolute devils. So if you're unlucky enough to get a grade 4 disease, then you have to try as hard as you can to keep your health after surgery, after radiation. That's where some of the naturopathic therapy approaches, such as the ones available at Oasis of Hope, can be very valuable to you. Thank you for your attention. Really, we hope you don't need us. We hope you have a long and happy and healthy life, and cancer is never part of your life. But if it is, you know, we're here to help you. In brain cancers, we usually are not the lead therapy. We're usually the helper therapy. Beyond the point of surgery, beyond the point of radiation therapy, we can help you to keep the cancer from coming back to a degree that some patients can expect to live long and happy lives. And we're here to help you. Thank you.